It's an intensive training that they get because, again, they have to make a lot of these decisions on their own, and they have to be expert in that, and we provide that in a safe environment. And when they're able to learn and do things, using their own mind and hands to be able to provide these services, they really get to translate that into their own practice. So we're training them to become experts, and we also prepare them for whether it's an academic career or a career in community medicine or even on to fellowship. They have that ability to be able to translate these skills into a meaningful practice. Emergency medicine here is great because the patients, the community, and the staff are all interfaced together. This is a small community. Everybody knows everybody. It's a big family, and we all support each other. So when we help our community, we're actually helping our friends and our family members, and it's a great feeling to be able to provide that kind of service for somebody that you care about. Guthrie Robert Packer Hospital Emergency Medicine Program exists because it's trying to impact the rural underserved space, and we are looking to make a better community for our patients. And we loved being able to start this program here. It's a unique program because there aren't a lot of rural programs available in the country for residents to choose. So we are super excited that we are able to make that impact, and we're looking for people that want to make a difference for underserved populations. The reason people would want to come to Guthrie for training is that emergency medicine in a rural program gives you the wide breadth of cases, and you are independent. There isn't a plethora of backup support who's going to sit there and provide the services where in a university type system you would be calling up for your backup services. In the rural environment, you have to take care of those cases yourself. So we teach our residents to be able to take care of their patients independently.
We're incredibly lucky here. We are at this huge tertiary academic center, so we have residencies and fellowships, and we do research. But at the same time, even though we have this big tertiary center, we actually operate in a much more community type setting in our work environment. So for example, what do I mean? If you have a peritonsillar abscess coming in or a hip dislocation, those types of patients and the procedures they need are first and foremost EM procedures every single time, which is amazing because that's exactly what you need to be prepared to do if you leave this residency and then you go out and work in like a critical access hospital, a rural hospital, community hospital, where you do not have all of those resources at your fingertips. You have to know how to do those things on your own to feel confident and be fantastic physicians out in the community. So our residents get to do that every day. Yet because we're a big center with a huge catchment area, we get those types of patients all the time. It's a great kind of conglomeration of how to set them up for success in that environment.
Guthrie was unique in that it offered a location that was both rural community medicine as well as an academic center. So you had the benefits of both that academic learning environment, you had multiple specialties, you had fellowships going on as well, and you have a very large catchment. So you have a lot of patients that come from a lot of different places, and at the same time you do have that community feel when you see people on a regular basis as well who are well known. So it was a unique opportunity to be both part of the community as well as serve a larger area.
I chose the EM residency program at Guthrie because it is a perfect rural community to raise a family, and I love having the ability to work with patients of all varieties with all sorts of pathologies that we may not see elsewhere. There's a wide variety of procedures that we get to do in the ER, from chest tubes to cardiac pacing, cardioversion, medical and trauma resuscitations, venous access. It's a lot, and I love it. So as a second year, I can definitely say that I feel like I will be very confident and a competent ER physician when I am done with training. I still have quite a bit to go, but from when I started to where I am now, I'm pretty confident that I'll be in a good spot.
We are a very family-oriented program. The communities are very tight. They're safe environments. They have lots of outdoor recreational opportunities, a lot of family interactions. So it's very exciting to give people those opportunities to have a good work-life balance, and we give them that chance to enjoy both their work and the communities that they live in.